this concept of vitamins and supplements. Now, if you ask me, and maybe I'm a little jaded, but I kind of believe that our world has convinced us that we're not healthy unless we're also taking vitamins and supplements, or that we need vitamins and supplements to maintain and keep optimal health. Well, the truth is, for most of us, that is not the case. For most of us who may not have any underlying medical conditions, meaning we can eat by mouth, and I mean that literally, okay? Meaning you can take in food by mouth and your gut properly absorbs nutrients, because that's where a lot of things are absorbed, right? If you have a functioning gut, GI tract, and you don't have other certain underlying conditions, actually one of the best places to get vitamins and nutrients is from our diet, okay? One of the biggest concerns and things I see in my office is I will have patients come in and they will have a bag of their medications, but they actually might be only on 2 prescribed medications and the other 10 are supplements. Now, the thing about vitamins and supplements is that they're not really regulated in this country. They're not really regulated, okay? And what that means is that there's a lot we just don't know about vitamins and supplements. I actually did a video about this, about the potential dangers of vitamins and supplements when we take them in excess. I've had patients and in that video, I talk about a patient who had severe abdominal pain, couldn't figure out what was going on, went on for months, was doing all this workup, come to find out that he was overdosing on some of the supplements he was taking. The minute we discontinued and stopped the supplements, his abdominal pain went away. I've had patients go into renal failure because of certain supplements that they were taking, workout supplements and things like that. Now, this is not everybody's story, and I'm not saying this to scare you. I'm also not saying that vitamins and supplements don't have a purpose, right? What I am saying is that for most people who don't have any underlying medical conditions and are able to take in food, et cetera, the best place to get your vitamins and nutrients is likely going to be food. There are exceptions. There are people who need calcium with vitamin D, especially as we get older and we're postmenopausal. There are people with documented vitamin deficiencies, vitamin B12, folate, etc., vitamin D deficiencies. That's a whole different thing, and your doctor will help you with that. But the other thing is, because supplements and vitamins are not well regulated in this country, we don't have a lot of evidence about what they do and what they don't do, which means there's not a lot of good trials saying that vitamin this does that, vitamin that does this, okay? Doesn't mean they're necessarily harmful, but sometimes it just means that we don't know what they'll do. And remember that vitamins and supplements can interact with your prescription medications, and it is possible to overdose and overdo it. So as we talk about things that seem healthy that can be overdone, when my patients come in with bags of vitamins and supplements, I really, really, really am concerned oftentimes about that, because oftentimes we don't know all the potential interactions that can happen when we take a lot of supplements and vitamins and how they can interact with other things. Anyway, guys, I hope this is helpful. As always, please put your comments in the comments. I want to know what you think. If you've not liked and followed my page, I invite you to do so. For those of you who send stars, I respond to you personally. Thank you so much. And yeah, it's good to see you guys. I will be back very soon with more videos. Love y'all.